Hello, Assalamu alaikum, and welcome to Tasha's Tales. Today I am joined by Dr. Anita Raja. Anita, would you like to introduce yourself?
Yes, so I'm Dr. Anita Raja. Thank you so much for inviting me on your show today. I am a general practitioner based in the West Midlands, and I have been a doctor for the past 14 years. I am passionate about women's health, having suffered with many, many gynecological problems myself from a very young age of 15. And I feel that it's ever so important for me to be a woman of color and advocate for women out there who are not aware of the consequences of different types of screening, diagnostics, and hence we're here today.
And similar to yourself, I'm a social worker by profession, so empowering people is something that I'm passionate about. But I just find your work really, really admirable because I can see your desire and passion to champion women's rights and women's health. So hopefully together we can have a conversation and inspire women to prioritize themselves and their health. Should we start off a little bit by you sharing a little bit of what you've done so far to raise awareness and to promote women's health?
Yeah, so I've done a lot of work around perinatal mental health because, again, being a woman of color, my dad is from Pakistan, mom is from Afghanistan. I was born and raised in Germany. And I just feel that when I look at the South Asian communities, when I look at the Black minority communities, I feel that there is a lot of health inequality. There is lack of understanding, and the lack of understanding is purely because we as healthcare providers potentially don't reach out to people who have different beliefs, different cultures, and it's very difficult to break through generational bias as well. So I've done a lot of work around sort of perinatal mental health, and I do keep harping on that string because I myself was a victim of. I call myself a victim because it's ever so difficult to suffer from depression. So I suffered from depression, sort of postnatal depression for a very long time, so 2 years, and I ended up on medication, and there was lack of acknowledgement around me for the condition that I was suffering from. And I belong to a very privileged family. My dad is an author of many books. I mean, he's someone who's well versed, well educated, someone again from a very privileged background, not someone who's not educated. And even then, I felt that there was I was in this dystopic world where, we're talking about human rights and all sorts of things, but there's lack of awareness around basic human conditions like mental health. So, I speak multiple languages. I can speak Farsi, I can speak, English, German, lots of sort of 5 languages I speak fluently. And I feel that I've made use of that. And secondly, the other thing that we are not aware about the way we should be essentially is cervical screening. So, it's a screening program, but I think there's lack of awareness around this. So I have done work around this. And then there's bowel screening again. I've done work around that. I've made awareness videos in Urdu. So Urdu and Hindi are very, very similar. So if I film in Urdu, people who speak Hindi or Punjabi would be able to understand that. And then we have sort of breast screening. Now, breast screening is another thing where people think, well, they don't understand why it's important. They don't understand that they need to attend these appointments. And they just feel that, there's nothing to feel at this point in time in my breast, so I'm absolutely fine. And some people don't even have the awareness. They don't know what to look out for when it comes for these, for example, for breast screening. Women don't examine themselves. They have no idea what they need to do and what they need to look out for. So I've done a lot of work around all of these areas. And I hope and I pray that, some women do end up watching these videos and educating themselves. We as women get very busy. So I'm a woman with 2 children. I have an 11-year-old and I have a 3-year-old. And I feel that in today's time and age, life is so fast paced that it's so hard to look after yourself. And it's so hard to attend, different appointments. Sometimes it seems like a complete faff. Sometimes you forget about it. It comes in the post and you put it somewhere, you remind yourself and life takes over. So it's very important to understand how important these appointments are and to prioritize yourself and your health.
I feel like, so when you talk about the breast screening, is that mammograms?
Yes.
Yeah, so mammograms, I think it's offered to women generally in this country after the age of, I can't remember what age it is, 50. And again, cervical screening, is that smear tests? Yeah, so smear tests, I think every woman in this country gets a letter after their 25th birthday. And the question I wanted to ask you specifically, because I know I've had personal experience of this being around other Muslim or South Asian women. If you're not sexually active, what does a cervical screening mean for you?
So, first of all, we need to understand why a cervical screening is done. So,
Yeah.
cervical screening basically, and understand where the cervix sits.
Yeah.
So that what is the cervix? Where does it sit? Why is it important? Do women who are sexually not active need to attend these screening programs? So the answer to this is multifold. First of all, it's important to understand where the cervix sits. So the cervix is the neck of your womb. The womb is the area that is the organ that's going to carry your baby, and the neck of it is called the cervix. Now, when we're doing cervical screening, we're looking for any changes in the cells of the neck of the womb. Now, these changes can be exacerbated by a virus, which is called HPV. This is the human papilloma virus, and we have like 200 strains of it. So many, many strains of it. 14 out of these 200 could cause cancer. The chances of you getting HPV are higher if you're sexually active. If you are not sexually active, then the chances of you getting HPV are low. 8 to 9 on 10 out of 10 people will clear HPV within 2 years because you've got immunity. And even if you contract that virus, you'll be able to clear it. However, some of these viruses, as I've said, 14, could cause cancer. So what they do is they change the lining of the womb, the neck of the womb, which is called the cervix. And the screening program is not a diagnostic test for cancer, but it can look at any changes which can occur in the lining of the neck of the womb, the cervix, on time so that we can deal with the problem. We can deal with the problem at the right time. So I would say the concept of having a hymen, the concept of being a virgin is a good concept, but when it comes to your health, it's ever so important that you do attend these screening programs. This is an obsolete concept. We need to prioritize our health. There is no guarantee that you're not going to be sexually active and you're not going to get cervical cancer. This is something that we need to know. So it's very important that you attend these appointments. There are different types of speculums we use. Speculums are little plastic instruments that we use. We insert them in your vagina, and we then look at the neck of the womb because we can, which is the cervix, and they're different sizes. So if you are not sexually active, then we can use very small speculum, which is called a virgin speculum, and we can still attend these appointments. So I think it's very important to, first of all, break from the generational bias of virginity. What is virginity? And once you're able to do that, you'd be in a better position to understand the importance of screening programs. And I mean, when it comes to these screening programs, we've got to understand that this is an excellent opportunity to get tested for potential changes that could lead to a more dangerous diagnosis of cancer in future. Now, the good news is that, the time that these cells take to become cancerous, so we're looking for precancerous cells, are many years in most instances. So we've got that time to be able to treat it on time. If there are any changes in the cells of the lining of your womb, then we will be able to refer you to the hospital, and you'll see a gynecologist who is specialist in women's health, and they would be able to treat the cells on time, which gives you a better chance of not contracting a cancer.
Absolutely. And I think I'm so pleased that you've explained in such a beautiful manner, because we want these things to be accessible. We wanted to change the perspective of it being a really daunting and scary experience, because actually it might be uncomfortable for a few seconds, but that could actually save your life at some point.
100%. And I think it's very important to understand what the test entails. So
Yeah.
first of all, you'll get someone, it's going to be a doctor, most likely a GP or a nurse who's going to do the test. She's going to consent. She's going to take your permission to do it. She's going to make you comfortable. In most instances, I'm saying she, because in most instances it is women, but men also do it. So male GPs also do it. And you're going to lie on the bed, they're going to explain the whole process, and they're going to insert a speculum, the instrument that we need to insert inside the vagina to have a look at the neck of the womb. And then we use a little brush, and we use the brush, and we just take a sample from the neck of the womb. We put it in a little bottle which is full of a fluid that is used to test it, and then we label it, and we close the bottle, and we send it to the lab, and you get your report. But the thing is, look, it's a good idea to come to the appointment taking some paracetamols just in case. Of course, the test sometimes can be a little bit uncomfortable. It's never, I would hope that it's never overly painful, but yes, there could be an element of discomfort. And of course, you can ask the clinician to stop if you're uncomfortable. You can take your time. You can have a break in between. And it's something that I mean, we're very lucky in this country to have screening programs. So it's something that's very important. And you need to understand that to be able, because you want to be there for your family. You don't want to, be growing some form of cancer that you're not aware of, or you want to nip the evil in the bud. And as I've said, not a cancer. This is not to diagnose cancer. This is just to look at any abnormalities within the lining of the neck of the womb, the cells of the womb, and that's all it is.
And like you said, it's so accessible, isn't it, in this country? At 25, you don't have to do anything. You get a letter through the post, and then you can proceed with it. Same with the mammogram. I know my mum had a mammogram, and she is quite proactive and seeking medical support, which is fantastic. So she had a mammogram. Do you want to tell us a little bit about the mammogram and what that entails for any women that are a bit hesitant, that are about to turn 50?
Definitely. And also, before I tell you about the mammogram, I would say this to every woman who's got breasts, that you need to examine them. There is no right way of doing it. So that's one thing you need to know. And there is no special technique for this. The best way to do this is either if you are in the shower or in the bath, and you put some soap on your hand, and you use your soapy hand you need to basically press your fingers around your collarbone, around your whole breast. You can do this in a clockwise manner, anti-clockwise manner. In your armpits, you need to look for any abnormal lumps or bumps. That's the first thing. The second thing is that you should look for any skin changes. So it's a good idea to do that. So, if you feel, and in front of the mirror would be fantastic if you could, once you've looked for the lumps and bumps, after that, you're out of the shower, stand in front of a mirror, good opportunity to do that. Put your hands on your hips and look for any puckering. Is there any tethering in your skin? Are there any dimples on your skin, the skin of the breast? Is there any color change? Does the nipple look abnormal? Is it inverted? So this is a medical term we use for a retracted nipple, which goes inwards, not outwards. And, have you noticed any sort of discharge from your nipple? Sort of a painless discharge, which is different, because your nipple should never discharge. So if your nipple is discharging, why is that happening? And if that happens, you must then book an urgent appointment with your GP, because your GP will then examine you and then will refer you to the hospital for a scan. Now, again, we have this opportunity every single night. So if you're someone who doesn't want to do this in the shower, please do this in bed. When you're in your bed, please have a good feel of your breast, have a good feel of your armpits, look around the collarbone. And it's important that you do this, because if you feel anything abnormal, we as GPs, I assure you, we never feel somebody's wasting our time. I certainly can speak for myself. I never feel somebody's wasting my time. We have a lot of people from Generation Z who come in with health anxiety because they have a lot of overload of information on the internet. And of course, any diagnosis, even if it's a cold, which is lasting for long, could end up in cancer on Dr. Google. So there's a lot of anxiety, and I certainly don't blame them because they've got information overload. I can speak for myself as a GP. I'm more than happy for you to come and see me. Even if it takes me 2 minutes of my time, I'd be happy to look at your mole. I'd be happy to examine your breast. I'd be happy to examine you and reassure you that there's nothing to worry about, rather than you umming and ahhing whether you want to see your clinician or whether you want to waste their time or not. So there is no such thing as wasting time. Please speak to your doctor. It's important to have health awareness, of course, and it's important to be educated and, know about things to look out for and everything. But it's important also that you speak to your GP if something as serious as a lump is anywhere present in your body. So that is very, very important. So that's the first side of it. So examination, awareness, knowing what the signs and symptoms are. The second side of it, again, is then attending your screening programs. Now, the problem is these breast screening programs starts very later on in your life. And it usually is when you're sort of, menopausal, when your periods have stopped. And that's when they start, sending you out these invitations. And on the day, once you attend the appointment, there's going to be a machine. The machine is going to examine your breast and it's going to look for any lumps or bumps. Sometimes it can be a little bit uncomfortable because there can be a certain amount of pressure on the breast, but it's never something unbearable. You'll be able to, get through it. And it's a fantastic tool to look at anything sinister in your breast. So you definitely want to attend these appointments. If you're on holiday or you cannot make it, please, please, please don't lose this piece of paper. Rearrange the appointment, but do attend it. So that's the second aspect. And I guess, it is important because breast cancer is something that can be quite life-threatening if we sort of diagnose this later on in life. Now, I'll give you some very interesting statistics. So brown South Asian women and women, from Black backgrounds are less likely to develop breast cancer compared to white Caucasian women. And the data we've got, which is limited, puts it down to the fact that they have children at a younger age, they're breastfeeding, which is again a protective factor. And it's probably that. But the downside of it is that because they're not aware of the signs and symptoms of breast cancer, if they have developed breast cancer, the diagnosis happens at a later stage with poorer outcomes, which essentially means that, yes, you're less likely to develop breast cancer, but because you were unaware of the signs and symptoms, by the time you've thought about it and you've actually said, oh my God, there's a lump there, it's too late. Or it is in a later stage. So the outcomes are poorer because it's a later stage of the cancer. So this was quite interesting for me as well. I call myself a clinician, a scientist, we are essentially scientists. It was just very interesting for me to look at that sort of comparison that, yes, we're more protected because we probably have children at a younger age and, we breastfeed. But having said that, because we're not aware of the signs and symptoms, we just leave it for longer. Life comes in the way. We end up living in sort of multi-generational households. We don't get time for ourselves. We're looking after our mother, their mother, our brothers and sisters. And, the way the social the construct is that, we're so busy with looking after other people that we don't actually get around looking at ourselves and after ourselves. So that was quite interesting. So I think it's ever so important that you examine your breasts and you seek medical attention when you feel there's anything abnormal. Don't worry about wasting your GP's time. They're happy for you to see them.
What's really interesting is that you mentioned statistics within the BAME community, because I'm sure in terms of statistics, when it comes to maternal health and deliveries, there's a really disproportionate statistic in terms of women from an ethnic minority background and their experiences within kind of the delivery and labor.
And maternal mortality, because they will not seek help on time because there is a huge barrier in terms of communication, in terms of understanding. They feel that they are less likely to be taken seriously. And this is a very scary
It's
thing.
petrifying. It's petrifying because even when I was giving birth, I almost felt like the paramedics weren't taking me seriously, that I was being a bit dramatic, even though I was minutes away from delivering. I was made to feel that I'm being dramatic. So I had first-hand experience of feeling like that, like I wasn't being taken seriously. So I can see why it would manifest in mortality eventually, because if that's your experience of not being taken seriously, I think I want to touch a little bit about kind of maternal mental health. Like you said, I come from a privileged background in terms of my own experience and understanding and knowledge about postnatal depression and about antenatal depression. Yet there was that stigma of seeking support and help, taking that first step, making time to call the GP and say, look, I'm really struggling here. And I think we really need to change the narrative and encourage and persuade the women around us to change that and prioritize themselves to be able to look after their families and their friends.
100%. But I think it's so difficult because we, as people of color, are people who believe in communities. We believe in familial hierarchies. And the issue that comes with this is the fact that we do not get time to look after ourselves, which is a huge problem. And also, when we look at the medical terminology, so I'm going to speak about Farsi, for instance, and in Farsi and in Urdu, Hindi, there is no terminology for the term depression. So there's only one word, which is pagal, which means crazy, which means psychotic. So if a person has a mental health problem, they can only be pagal, which means they're crazy. And the same in Farsi, there's if you have mental health, you're either psychotic or not psychotic, but there's no in between. There's no term for personality disorders, no term for bipolar affective disorder. There's no terminology for depression. There's just not a word that would describe that certain condition, because in our society there is no acceptance of these conditions. So you've got to be grateful, and you've got to thank your Lord for your blessings at all time. And if you are being low in your mood, you're ungrateful. That is the sort of association we get. And I certainly, from my own experience, have learned that when I was depressed, I was told again and again. So I was still in my 20s when I had my first son. And I feel that I was told again and again, why are you low? You're so ungrateful. You're a doctor. You have a lovely husband. He cooks for you. He looks after you. You've got a beautiful son. The son, is healthy. What are you depressed for? Like, as if
Yeah.
I am trying to depress myself and I'm inflicting this upon myself. No understanding of whatever happens with the neurotransmitters in our brain. Absolutely no understanding that this is like this is a chemical problem which is happening inside the brain. This is pathological. Just sort of blaming it on not being grateful enough. So gratitude is a big thing in our religions and our cultures, and whether we are from any religion, people of color, if they're following a certain religion or have a culture around them, there is a culture of being grateful for everything. And if you are depressed, then you're ungrateful. This is the sort of association that's made. So it's very difficult.
The concept's not there that you can be grateful
No.
but depressed at the same time. You can be really grateful to have a lovely husband, a lovely home, a lovely family, but they can both go hand in hand, and you can still be really, really depressed. And
Yeah, it's just doesn't exist. So it's people like you and I who are going to be changing that, I hope, God willingly, in a positive way by sort of talking about this again and again, because we've got to keep harping on that string, and we've got to keep talking about this because this does happen. And we need to understand, like, which I certainly in practice, I always give my patients this example, because of course I come across patients who will say things like, doctor, I don't want to take that medication. Doctor, I want to deal with this myself because I feel like a failure when it comes to mental health. And they're very reluctant to go onto medication, especially people of color, because they associate going onto medication with failure and being a failure in life, being an embarrassment to themselves, to their families. Especially men, they find it very difficult to go on medication and accepting the fact that they're suffering with mental health problems. And I always ask them this question, and I say, look, if you would have had a fracture of your limb, and I would have said, you need to go to the hospital and they need to treat you, would you say to me, sorry, I feel like a failure, I'm not going to the hospital? Or would you run to the hospital because you want this fixed? And they say, yeah, we would go. And I was like, exactly. So if you would have high blood pressure, and I would say to you, you'll suffer from a stroke. If you don't take this medication because this is life-threatening, your blood pressure is extremely high, would you take that drug, or would you tell me that you feel like a failure? And they're like, no, we would take that medication. So I think, again, when it comes to mental health, there is such stigma around it that people fail to acknowledge the root cause. And life is difficult. Look, we are in a world where everyone is trying to be perfect. There is a lot of social media exposure. People are looking at my posts and they're thinking, oh my God, she has everything. They don't know my struggles. The reason I like talking about my struggles is that, you've got to keep things real. All of us have problems. I've had a very late miscarriage in life at sort of 20 weeks, and I didn't even know that the baby was no more. I went for a private gender scan to find out. I mean, people need to know that when they are looking at social media, for instance, which is the root cause of a lot of mental health problems at this point in time, because we're trying to compare, we're trying to be the best version of ourselves, we're trying to have unrealistic expectations when it comes to appearance, weight loss, carb, children need to look perfect,
Relationships, oh,
relationships, everything, you know.
parenthood. Yeah, the list could go on and on.
Yeah, the list can go on and on. And it that simply doesn't exist in real life, you know. Life is brutal.
Can I
And
just touch upon the miscarriage, please? Because I saw a clip of you wanting to change the terminology of how we describe miscarriage and baby loss. Am I okay to just ask you
yes,
about that a little
yeah.
bit? Because I think
So
it's really, really important. I've supported at least a handful of friends who've experienced this, and it's hard, it's brutal. It's brutal for them, and it's brutal for someone supporting them, because I'm really guilty, because it's not something I've experienced. It's something I wouldn't wish on my worst enemy. And it's about getting it right, in terms of being that support network.
I feel that some of the terminologies that we use in medicine can be quite unforgiving. And one of them certainly is miscarriage, because when you use the word miscarriage, you were saying that this woman miscarried this baby. She made a mistake. Her womb made a mistake. The womb failed her and her family that were actually banking on her womb for this baby. And it's a lot of pressure to put on a woman. And I was, well, I am a woman. Not that, I mean, I'm done having children, so I'm probably not going to have more children. But when I was a woman who was trying to have children, I felt that there was a lot of pressure on me. I had my first myomectomy, which is a surgical removal of a fibroid, which is a benign tumor of your womb, at the age of 15. You know, so I was 15 when I had fibroid removed, and the size of my fibroid was 1 kilogram. It was the size of the head of a baby. That's how big it became before I was actually able to tell my mom that, Mom, I'm actually suffering. You're not going to believe how unwell I became, because I was so ashamed of telling my mother that I was bleeding every single day. I was 15 at that time, and my hemoglobin, which should be 12 and above, was 5. So I was bleeding to death. That's what was happening to me, but I wouldn't speak to my mom. And I remember we had like a helper, and she went to my mom and she said, do you know that, she's got trousers which are full of blood, and she puts them in the washing machine. So this is how we basically, how my mom found out that I was bleeding to death. And then she took me to a gynecologist, and I remember I had a scan. And again, the same thing, I'm only 15. They're not doing the vaginal examinations. They're not doing vaginal scans, because, I'm a virgin. I'm only 15. So I was having all these scans done, but, my fibroid was so big that we didn't really need to have like a examination from down to, it was 1 kilogram. So it's quite big. And then they found out that I had a fibroid, and then the whole palaver about how do we get this fibroid out. We can't get it out from down below because she's only 15, so we need to do a laparotomy. And then laparotomy is basically a surgery that's done from the belly. They cut you open and they take it. That's basically what they did when I was 15. Now, I got rid of the fibroid, and then I got endometriosis 2 years later. So I was 17, and I had to have another laparotomy because I'm still young, not married. What do we do? What do we do? Another laparotomy. And then they had to open me again, and they had to take the endometriomas out. Now, this is how I started my reproductive journey. And I still am someone who suffers from really bad, painful, heavy periods. So, if a woman comes to me in general practice and says, I am suffering with my periods, I give them the extra 5 minutes, because I know how it feels to be a woman in that position. If a woman comes to me in general practice and she's got fertility issues, because I've had them, I give them extra time. And I signpost them to the right charities. For example, Tommy's is a phenomenal charity.
Amazing. Yeah.
Really, really good. So I was their patient. And this is why I'm an ambassador advocate for them as well. And so, it's I think as a clinician, I feel that if you've had personal experience, that just makes you a better doctor. It just makes you a better person at listening to your patients. So yeah, I mean, it's ironic, it's bad, but it happens. And I, as a child, did not have the confidence. Well, I say child, as a young woman, didn't have the confidence to tell my parents that I'm bleeding to death. And I was genuinely bleeding to death, and I had to have blood transfusion and all sorts of things, and those were the worst years of my life. And imagine, I was trying to do my GCSEs, and I'm in and out of hospital, and then I end up doing my advanced levels at A levels, and I'm just again in and out of hospital having these major surgeries. So I think, I've been through it all, and I just feel that it's made me a better, stronger person. And I'm going to talk about it
And I
because,
think you're fantastic. I could easily sit and listen to you all day because you're a breath of fresh air. I think just speaking to you makes me feel like I'm liberated. I'm in a safe space to say words such as vagina and breasts and not be judged or think that they're bad words. They're not, they're a part of us. I think it's really refreshing. I just can't thank you enough for your time, really, Dr. Anita. I think I wish I had a GP like you. I wish you were in my practice. No, but honestly, I really, really appreciate everything that you do. I'm sorry you've had to suffer so much to be able to get to where you are. You know, you've got your own personal story, but I wish you didn't have to go through. I wish no woman has to go through that. So,
I I think my message to anyone who's listening, I really wanted to have a daughter, but God gave me two sons. Actually three, the baby I lost was a boy as well. And I feel that the biggest gift you can give to another woman is, if you are the mother of boys, if you are the mother of boys, sons, please educate them. So my 11-year-old knows everything. I have spoken to him about everything, including what sex is, because he asked me that question and I didn't want to lie to him. And the way I put it out to him, which is a great tip for any woman who has a son. So it's really funny how this happened. I'm going to quickly tell you. So I was working from home and my son came in. He's very interested in medicine and things like that. So he got hold of so there's this GP book that I have. So it's a book for general practitioners. And he read urinary incontinence during sexual intercourse. So he comes to me and he says, "Mommy, what's this?" And I started laughing. I did not know what to say. So what do I tell him? Do I not tell him? He was 10 at that time. Do I sort of how do I tell him and not make it sound like it's something very special, or just make it sound like a mundane everyday thing which has to happen. And I said to him, my son is a very good Muslim boy. So I said to him, I said, Nirvan, look, first of all, don't judge me. Okay, if you have any problems with what I'm going to tell you, you go and argue with God, because he makes the rules. We just follow them as humans. The Prophet Muhammad sallallahu alaihi wasallam has done this. Your grandparents have done this. So my mom raised him because I suffered with mental health. So she had him for 4.5 years. So my mom raised my son, and she was really young when I had my first one. She was in her 40s, so she raised him. So I said, your Nani has done it. Just so that he knows, Prophet Muhammad has done it. Nani has done it. Everybody does it. We just follow the rules. We don't make them. And then he was like, but what is it? And then I had to explain to him that, like when people get married, they have, because we're Muslims in our religion, we have to get married before we do this. But when we do this, this is what happens. And he's like, oh, Mama, that's so gross. And I was like, yes, it is really, it is really gross. But he said, and I'm so glad that I had that moment of enlightenment to sort of deal with this scenario in a very clever way, I'd say. And he said to me really quickly, okay, so it's like peeing and and pooing. So we've got to do this, because if we don't do this, we'll die. But it's not nice to talk about. And I was like, yes, maybe, and that's how we ended the conversation. And I just feel that, because my son has seen my journey, so he has seen me put a towel on the bed when I'm on my period, because I can have really heavy periods. So he's asked me that question. He said, Mama, why are you putting a towel under yourself when you have your period and at night? And then I have not lied to him to say, I'm going to pee or I'm going to poo. I've said, look, I have a period. Women bleed every month. And he understands what periods are, and he understands they can be very painful. And he's an empath because of what I've told him. He has seen me, and he knows that it's a painful process a woman goes through. And he even said to me once, he said, Mama, you women have it so hard. And I said, we do. So this is the type of husband I want. I want him to be a phenomenal husband. I want him to be kind to women. I want him to understand that women go through a lot in a month, lots of hormonal changes. It can affect their mental health, can affect their mood, it can affect their physical health. So I would say to any woman who has a child of the age of 10 and above, please speak to them before the school does.
I
Because you
agree.
can.
I think we don't give children enough credit. My 5-year-old has known about pregnancy and a baby growing inside mummy's tummy from the age of 3.
Wow.
Something we're really open about. Mummy's got a baby in the tummy. We've got to be really careful. Mummy's going to the hospital, and mummy's gonna have the doctors and the nurses are gonna help
Yeah.
mummy deliver and have a baby. He knows that. He might not know the mechanics of it,
Yeah.
but he has that concept, which is fantastic, and it's needed. Again, to have the empathy and the understanding and to take away that stigma and taboo that sadly we've grown up and experienced. But no, honestly, so refreshing to speak to you and thank you. I really, really appreciate your time.
Thank you
And
so much for having me. Thank you so much. And yeah, I mean, that's just my message in the end to women, because we are going to empower ourselves and the women who come after us by empowering our boys, our sons. They need to know, because we as women know what we're going through. They need to know what we go through.
it's a
And I hope,
collective journey.
definitely. Thank you so
Yeah.
much.
No, thank you. I really appreciate your time. Thank you. Take care.
Take
Bye.
care. Bye.
Bye.